In this video, I want to guide you through the foot, ankle, and knee self-assessment, individual joint motions that are important for you to have full motion of and control over. While in a therapy clinic, we're actually going to be determining very specific numbers for the ranges of motion. For these assessments, we're going to just label them 0 through 2. We just want to get a very general understanding about what limitations we have and where we are either starting from or in our reassessments, how far we've come and what still requires some focus. You're going to take the assessment in the beginning to start, work through the whole course, and then at the end of the course, you can retake the assessment to see how things have improved, and then you can find what things are still limited, and then you can work through the course another time. Multiple times you can do that. Even the things that are in the beginning that may seem like it's not that good of an idea to go back to will always be a good idea to incorporate, because you're never going to not need very deliberate joint capsule training, and to make sure that you're always maintaining control over ranges of motion that you're improving. Okay, so while the programming is geared towards opening up available motion, we are also focusing on having control over that motion. Let's begin with assessing our foot. I'm going to have you use a yoga block if you have one. It really will help to control, because if you're just starting this out in the beginning, you probably have some dysfunction from the foot, ankle, and to the knee. And make sure that we're deliberately only working the foot and ankle. And I want you to also think about keeping the knees in line with the feet. The yoga block is going to help us to maintain that alignment. Make sure that the ball of the foot is down, touching the ground, the outside of the foot, and the heel, so all 3 points. Maybe sit on the edge of the chair to help you. First things first, we're going to check what motion we have in the big toe. Usually, bending the toe up is going to be much greater than bending the toe down. If you have a lot of flexibility, up and down is really no problem. But we want to do it with active motion. If I just grab my toes, they'll be able to move a lot further than me just actively trying to do it. I want to know how much motion do I actually have and have control over. I want you to understand that when we're grading the assessment, if you have pain starting to develop, you are going to pause before that pain really builds up. And that is where you're going to score yourself from. If we force a joint into any pinching, pain, and an inflammatory process, if you have arthritis, that is not a good gauge on where your function is. Because when you're moving about the world, your body is avoiding that spot. So if I'm going to be moving my toes, and I know that I could do a full range of motion through the toe, but halfway there I start to get pain, I'm going to stop at that halfway point and I'm going to grade that as a 1 instead of a 0, okay? So keep that in mind. You never want to go the full range. If you have pain, it doesn't count. Let's now work on our big toe extension. So we're going to basically just lift the big toe off the floor and see where we can do that. So on my right foot, this would be a 1. And on my left foot, this would be a 0. So I can pull that big toe basically all the way up on my left side. I can't really pull it all the way up on my right side. So that would be a 1. If you are below that or you can't lift it off the ground, then you are a 2. Now we'll work on the big toe flexion. So we're going to be curling the big toe. So let's crunch that big toe down and see where that takes us. That's going to be a 0. That's really full motion. On this left side, that is also a 0. I have full range of motion. So if you are obviously halfway, that will be a 1. And if you really can't bend that toe at all, that would be a 2. Let's now test our ability to spread our toes. So just lift those toes up. It would be your inclination to actually press the big toe down to spread them, but we want to just see really what control do we have here without using anything to assist us. So my toe spread here, although it seems good with the big toe, the middle toes are still not spreading as much as they should be. So I'm going to give myself a 1. So this is kind of, it's better than it used to be, but it's not as good as it really needs to be. It's not ideal. So we're not going to give a 0. I'm going to be a 1. And if you're anything kind of below that, you really can't spread your toes, incrementally moving that big toe away, that is going to be a 2. For the next section, for the transverse arch, it's more of an observation. When you just lightly tap the front of the foot to the floor, there's really no pressure into it. I want you to look at this arch here in the front of the foot. Is it lifted up? This positioning here, where it looks relaxed, this kind of looks as one kind of smooth level, that's going to be a 0. So when my foot is relaxed and my toes are just gently tapping, the pads are just gently tapping on the floor, I have, my arch is full and it's supported in this position. If you are pressing the, just gently tapping the toes down and you're kind of sunk down through here, that you actually feel some pressure at the kind of knuckles of these toes as well as the pads of the toes, then that's going to be a 1. And then if you're really collapsed and you have hammer toes and everything's kind of pulled up like this and like sunk in, then that is going to be a 2. So you have like a full collapse through that transverse arch. You really don't have any control over that, and you have the hammer toes developing and etc. Now we want to look at our plantar arch. So when we look at our plantar arch, I want you to see if this generally feels relaxed. Do you have trouble keeping the big toe down? That's important, because if you're locked in that supinated position, which a lot of people's feet are, especially when this transverse arch is collapsed and everything's stuck through here, you've got this kind of high point through this section of the foot. No matter how high your arch generally is, because people have low arches, average size arches, and then high arches, but you should still have some motion through the foot. But if you're totally restricted into this position here, and you have a lot of trouble getting that ball of the foot on the ground with the same amount of pressure as the outside of the foot and the heel with the knees in line, then that's going to be a 2, and you're locked into that restricted supinated position. Now, if your ankles are really collapsed in and you're even just sitting here, you can see that this is all pointing to the inside, rolling to the inside, and you have excessive pronation through that ankle. That's also going to be a 2. And then a 1 is going to be, something, between the ideal and then those extreme positions. And you want to be able to have your foot relaxed and have everything just line up ideally, that you have some flexibility through these bones through here and everything is not totally rigid. That would be a 0. So I would mark myself a 0 through that arch. I can actually successfully do these short arch crunches. That could be another way that you could look at that plantar arch and see, do you have the pliability through the arch joints and the control over that motion? Next part of the evaluation is going to be for our ankle. I'm going to put the yoga block between my knees. If you have one, you should use it. It's just going to help you to isolate the work at the ankle joint. So from this ground position, you're going to keep your heel on the ground, and then I want you to lift the toes up towards your shin. And so this range of motion here, this dorsiflexion of the foot, this range I'm going to grade as a 0, and then here would be a 1, and then obviously just off, or you can't really lift off, that's going to be a 2. Let's check the other side. Keep the heel down and lift the front of the foot up towards the shin, and that would be a 0. Here would be a 1, and then anything below that or can't lift it would be a 2. Now we're going to press the foot out in front of us. I'm just going to move here so you can see a little bit easier. So that heel is to the ground, but I have a 90-degree angle at my ankle. Now this is going to be our start point, and then you're going to press through the ankle for that plantar flexion. And so you should be able to, in a sense, create a straight line in the front of that ankle joint. This would be a 0, and then here would be a 1, and then anything from that 90 degree to here would be a 2. You know, so just give yourself a general idea of you can do the full thing. You're either halfway or you're really less than halfway. Okay, so let's check the other side. Have that 90 degree angle to start. I'm pressing through, opening up the front of the ankle so I have a full straight line there, so that's going to be 0. Anything from 0 to halfway point, it will be 1. And anything from the halfway point to the 90 degrees is going to be a 2. Next, we're going to use this line, the tape line, to help us in guiding our foot, just to help give us an understanding about what's going on. So put your right foot along the middle of the tape. You're going to put your heel right in the middle. The heel is going to stay right there, okay? And now this is important that we want to make sure we have the yoga block here, because you don't want to be moving the thigh. We want to keep the thigh there. We're only going to be moving from the foot and ankle, okay? So this is actually going to be our next. We're going to do the E version, and so what we're going to do is keep the heel down, and now I want you to lift the outside of the foot to try to show the bottom of the foot towards the outside. You're not going to have as much range of motion as the other direction, so this is actually a 0. The halfway point again would be 1. 1 to 0 would be a 1, and then anything below 1 is a 2. Let's check the left foot. Put your heel right in the middle of the tape. Squeeze that yoga block. You can use a pillow too if you need to keep that heel and thigh stable. And then we're going to lift the inside of the foot to show the bottom of our foot to the inside. Again, this would be a 0. Midpoint to 0 would be a 1, and midpoint to the floor would be a 2. All right, let's do our E version. So we're going to lift the outside of the foot to rotate at that ankle to try to show the bottom of the foot toward the outside. Now, again, this is going to be a 0. This is not as much motion as the other direction. And then halfway point is 1, and then floor to the halfway point would be a 2. Now we're going to work on our abduction and adduction of the ankle. So just to give us a guide, I want you to put the heel down, but then the big toe kind of right in line with the middle of the tape. So my tape has a nice stripe on it, which helps. This is going to help give you an idea of really how much motion you're getting. It's just going to give you something to cue you from. So again, using the yoga block to keep our thigh stable, we're just moving the foot at the ankle. So our adduction is going to be rotating the foot to the inside. So you want to just keep it on this horizontal plane. We're not rotating it. So this would be a 0. And obviously halfway point would be a 1, and that would be start to halfway would be a 2. Now we want to do the same thing for the abduction. So rotating it out now, or fanning it out, but see my knee is still staying forward. If you're turning the foot out and the knee's going out with it, that doesn't count. So we have to separate that motion. So turning the foot to the outside, flaring it out. This is going to be a 0. You don't have as much motion flaring to the outside as you do to the inside. So that's going to be a 0. Halfway point would be a 1, and then a 2. So I know it can get a little confusing. I would not give yourself the benefit of the doubt in the sense of you want it to be good. You want to really find the issues that you have so you can correct them. So if you're like, oh, I'm not sure if that's a 1 or 2, or, err on the side of it's more difficult than you want it to be. Okay, other side. Put the big toe in line with the middle of the tape as a guide. Keep those knees straight forward, so you're only moving, fanning that foot from the ankle. Let's pull it to the inside. Okay, so that's going to be a 0, midpoint 1, 2. All right, and let's go fan it to the outside for 0, 1, 2. Next on the test is for our knee. So we're going to start just in this 90-degree seated position. This isn't totally precise because our knee flexion is also dependent on what's happening at our hip because of our quadricep. But we're just trying to get a general sense for what's happening at the joint. So we can do it in a seated position. As you get more advanced, you can do this from a kneeling position to kind of get a better read on what's happening here through this tissue. So our flexion is going to be pulling. Can you pull that heel towards your butt and really close down the back of the knee joint as much as possible? So that would be a 0, full knee flexion. Obviously halfway is going to be the 1, and then 90 degrees to 1 is going to be the 2, and if you have pain, you're not going to move into it. So same thing for the extension. We're starting at 90. That's going to be our base marker. This would be 1, and then full knee extension would be a 0, okay? So you're going to test that. We'll do the other side. Starting at 90, I'm going to go into flexion. Can you close down that knee joint as much as possible completely? That's 0, 1, and then 2 from that 90 degree. And knee extension, so that would be 1, that's midpoint 1, and then full extension is 0. So we want to actually test that internal and external rotation of the tibia at the knee. We're going to do it with the knee in flexion, and we're going to do it in extension. It's really important. When you start going through some of the training, you'll see how the angle of the knee flexion or extension really does change your ability to have control over that rotation of the tibia at the knee. So let's first do our right side. We're gonna hold onto the thigh to our chest as best as possible. You could always put a pillow here too to help you. Now we're in full flexion of the knee, that knee's totally bent, and now we're gonna try to turn that tibia to the inside. Okay, so it's all kind of relative. I find this very easy here. You know, I pretty much have full range of the tibia rotating at the knee. When I rotate the tibia, you know, my thigh isn't moving. There's really no problem. So I'm going to give myself a 0. A 1 would be you have no problem holding the thigh and you're kind of like, you know, halfway-ish, you know, but you got some motion. And a 2 would be you really don't have any motion, and you really can't do that without moving the thigh. So you really don't have any tibial rotation to the inside. So now we'll go to the outside, the external rotation. So now from here, same thing. So from here, I don't really have any issue turning that tibia outward relative to the knee. The knee's straight forward, the thigh isn't going anywhere. And that's basically the full available motion that would be at the knee joint. So this is, again, a 0, you know, so halfway point is 1. You know, if you really can't activate any specific motion of that tibia, you know, it's going to be a 2. Now let's do it into extension. So you can use the yoga block here to help you to prevent your thigh from moving. And then in that extension, we're going to try to turn that tibia in. This is my problem spot. So you can see I'm having trouble turning that tibia to the inside. So I'm going to give myself a 1. I am getting some motion, but it's really not as much as I would like. It's really a struggle for me. And then turning out, same thing. I'm a 1. I have some motion of the tibia at the knee, but not as much as I could have. It's more challenging. So grade yourself accordingly. Okay, left side, I'm going to pull that knee to our chest. Full flexion of the knee, and let's rotate that tibia to the inside. Where are you at? So I'll give myself a 0. Same thing, I have full rotation there. And then I can rotate all the way out as well. So my external rotation and my internal rotation will be 0. And now we're going to go into the extension portion. Straightening out that knee. And now we're going to try to turn that tibia to the inside. Same thing, I'm going to give myself a 1. I do have some motion, but not as much as I could. And to the outside, that actually it's almost a 0. I'm going to give myself a 1, but I have a lot more motion than I do on the other side. It's just, I can feel there's some resistance there, and I could be doing it a little bit better than I am. So for me, that would be a 1 as well. 2 things to just generally assess on the foot ankle assessment would be your plantar arch. Where is your arch height? Are you really low to the ground? Do you really have almost no space underneath the arch of the foot? This would be kind of an average height, and then are you a lot high? This would be a high arch, you know? So either your average is right in the middle, or you're lower than that, or higher. Just, you know, you can mark that off on your sheet just to give a general understanding about your foot and ankle. Now, the accessory bone is actually going to be right here. It's a prominent part of the bone that happens because the posterior tibialis tendon hooks around that bone, and there's a lot of stress and pulling there. So if you have a big knobby bone kind of protruding out the side here, that is an accessory bone, you know, so you can just mark that on your sheet whether you have that or not. Usually that's going to happen for people who have lower arches and have a lot of extra pronation instability on the inside of the foot and ankle there. Great job. So you've concluded the foot ankle assessment. If anything was unclear, if you have any questions, make sure you reach out in the community or send me a private message in the chat. Getting the assessment right so you really understand where your limitations are and what the goals are is super important, and I think it's a fundamental piece to you really being successful with the program and getting the most out of it.